Welcome to CABRI's first webinar on managing budgetary pressures in times of COVID-19. I think we're doing okay in terms of running the webinar. I think it's going quite smoothly so far, but there is a lot of traffic on these websites. So we are having a few difficulties. My name is Danielle. I'm a public financial management specialist at the CABRI Secretariat. That's the Collaborative Africa Budget Reform Initiative. I'll be moderating today's session. I see we have close to 200 registered participants, which is pretty exciting for our first webinar of this type. I'm really grateful that so many people have joined us today and to see so many names that I recognize from our Building PFM Capabilities program and from our policy dialogues. But yeah, today will be a 90-minute discussion looking at the budgetary pressures from COVID-19. And we'll begin today with a presentation from CABRI's Executive Secretary, Neil Cole. Neil will look at the budgetary pressures that different countries have faced in the past and look at how countries are managing the current crisis. Neil has extensive experience at the National Treasury and has led CABRI since its formative years and is my dear boss. Following Neil, we'll hear from Dr. Mark Blecher, who's both a PhD and an MD, and the Chief Director of Health and Social Development at the South African National Treasury. We're very glad to have Mark here to share with how South Africa is managing the fiscal fallout of not only a ratings downgrade and the pressures of a lockdown, how we stimulate the economy, but also financing the health expenditure associated with COVID-19. After Mark, we'll hear from the Director General of the Budget Office of the Federal Republic of Nigeria. That's Ben Akabueze. Ben will share with us how Nigeria is managing the pressure from the sudden and dramatic drop in the oil price and COVID-19. And after that, we'll begin with your questions, which you'll be posting in the Ask a Question section below. And if you see a question that you find relevant for your purposes, please upvote that question, as that'll be the first question that the panelists will be asked. But you're also welcome to use the chat box to the right. For any technical issues that you're having, we do have CABRI support online, so that if there's any issues that come up there, they'll be able to answer and help you with that. But yeah, please continue asking your questions. This is a 90-minute discussion, and so we do have time for questions, but we'll now begin with our first panelist, Neil Cole.
Thank you, Daniel, and good morning, good afternoon, and good evening. Okay, I am really pleased that there are so many countries that have joined the webinar. As Daniel said, this is our first in a series of webinars that we're going to be running on COVID-19 in terms of its budgetary and financial implications. And who knows, depending on how long we locked down, it may be the format that we are going to have to use for some time to come. I do come to you from in my home in Pretoria. And as Daniel said, I am a former budget manager, and you can change the slide, Daniel. And as a former, I just want to make sure that I am coming through, and that Daniel is able to. Daniel, can you hear me?
I can hear you, Neil. Your camera goes on and off.
You can move the slide on. So as I was saying, as a former budget manager, I know that budget managers are frequently confronted with changing circumstances during a fiscal year. I mean, these are by their very nature quite disruptive and can even disrupt the best prepared budgets that we put together. Now we become used to some of these being fairly routine, and these ones require no more than regular adjustments to plans, while others can become chronic and have a great and significant impact on public finances. I think what we're going to be covering today, and the one that many African countries have experienced in the past, are these extraordinary budgetary shocks. These are by their very nature sudden and can significantly threaten budget stability and service delivery. I mean, COVID-19 has and is causing an extraordinary budgetary shock. And this is irrespective of where a country is in its curve, because of some of these endogenous and exogenous shocks, and I'll get to some of those later on in the presentation. Can you change the slide, Daniel? So as I said, several African countries have had their fair share of extra budgetary pressures. It was the reason why we held a CABRI conference in 2017 to look at this issue of how to manage budgetary pressures, and in particular looking at extraordinary budgetary pressures. Several presentations were made there, presentation from the Central African Republic on the political crisis that had taken place in the country, a crisis that many would agree wreaked havoc on its economy, resulting in unemployment to be very high, and a poverty rate of almost 75%. We also looked at cyclones in Madagascar, social demands such as the call for tertiary fees to fall in South Africa a couple of years ago, and then also the wage demands in Cote d'Ivoire and the impact that these have on the budget. We also covered macroeconomic shocks such as the decline in oil prices and decline in trade revenue, respectively in Nigeria and in Lesotho. And I'm sure in the DG's presentation later you'll cover that in a bit more detail. I mean, the one extraordinary budgetary pressure that we looked at, which I think is relevant for us today, is the Ebola epidemic that broke out in the three West African countries, Liberia, Guinea, and Sierra Leone. And whilst not developing into a pandemic, the steps that each of those countries needed to take look a lot like the steps that countries are taking now in their response to COVID-19. So in Liberia, there was also, and in the other two countries, a decree that put in place an emergency. There was a high level of isolation, cancellation of flights, etc., and quite an extraordinary movement and changes to the budget to deal with the health crisis, but also at the same time to deal with the economic fallout as a result. Can move on, Daniel? So some of the common responses that we've seen when these extraordinary pressures do occur. Daniel, you can move the slide. Thanks. So some of the common responses that we see when these extraordinary pressures do occur can be located into immediate responses and some of those medium to long-term responses. Amongst the immediate responses is that we always see a cutting of the appropriate budget, or quite an extensive reallocation of the budget. So in the case of Liberia with the Ebola crisis, the allocation to the health budget increased by 60%. The overall fiscal framework increased by 24%. So a very significant shifting of funding towards the Ebola effort. We do see that capital expenditure is the one that always suffers from the Central African Republic, and also in the case of the response to the Ebola crisis, except where capital expenditure such as expenditure on roads is considered to be important in the effort that is undertaken. There's always increasing short-term borrowing. We're going to see now with the funds made available by the World Bank and the African Development Bank will certainly contribute towards short-term borrowing. Mopping up of idle cash balances, and I'm sure Mark is going to touch on this in terms of how the compensation funds and also the unemployment insurance funds have been used in South Africa. There are a few countries that do budget or include a contingency reserve in their fiscal framework, but for the scale of this crisis, countries found that those contingency reserves have not always been adequate. Just shifting to some of the medium to long-term responses, we always see countries, and this may be out of necessity, focusing more on value for money issues. So how do you maximize the efficiency in existing spending or the spending or the budgets that are still remaining? Increasing resources from existing tax bases by improving revenue administration, and it's very likely that we're going to have to shift the focus very strongly towards domestic resource mobilization, because although we've not seen how ODI or overseas development aid has been affected yet, but this is very likely to happen. Some countries are insuring against natural disasters. There's the African Risk Capacity, a facility that started off as a facility to respond to droughts, but has opened up to look at all kinds of other disasters as well. So just some of the lessons from previous crises. So you can move on, Daniel. That there are occasions where pressures usually coincide, which contributes even more to the budgetary crisis. I mean, if we think about Mozambique, right? Cyclone Ida hit Mozambique at a time when the country was still recovering from the debt crisis. What these pressures always expose is institutional weaknesses that always, does present opportunities for improvement, but in that crisis, that capability gap that we always speak of does get widened. And I believe that our friend Matt Andrews is also registered, and maybe Matt would also want to come in during the Q&A session to look at these issues of institutional weaknesses and capability gaps. I think what COVID-19 is certainly showing, and previous crises in Africa shown, is the need for good data. So decisions on when countries are going to open up, when they're going to end their shutdown, when they're going to allow a return to some degree of normality is going to be largely dependent on what happens to that curve. And to know that good data is going to be required. Public finance management systems, so how strong our systems are, the state of our public finances as we enter or entered this crisis, largely determines how we are able to respond, or how we have been able to respond. So this idea of making provision for a storm is one that I think presents us with a whole set of new lessons once again. I think communication is going to be important, especially when we do have to make the trade-offs, whether those trade-offs impact on changing some of the decisions that we've taken in terms of wage increases, and if it's necessary to roll back those decisions, that is going to have to be communicated, and communicated as a critical trade-off that has to be made. When we reallocate funding from one program to another, that is a trade-off that has to be undertaken, but one that has to be communicated. Okay, so how extraordinary is this current crisis? You can move the slides, Tanya. There's an interesting report that was prepared by TRALAC for the African Union, where they allocate the pressures that African countries are going to face into exogenous and endogenous. And some of those exogenous ones are the trade links that are going to be affected, especially by our trade partners. Clearly a decline in remittances. We find that migrant workers largely or in large numbers have been returned to their homes willingly and unwillingly. An expected FDI, foreign direct investment, drop between 5 and 15%. Although the ODI or a potential ODI decline is not yet revealed, the pressures in donor countries, in Europe, the US, and in other places, it's very likely that there will be to some of those endogenous factors. Well, we have a ban on tourism. So it's an important sector for many African countries, South Africa, Kenya, several others. So tourists are just not coming, and the sector has ground to a halt. I mean, just issues of how we as nations are going to deal with morbidity and mortality as this virus spreads is going to be one that's going to hit us in the very near future. So just the decrease in domestic demand for our, especially Africa, the commodities, the loss of tax revenue, and I'm sure Ben is going to pick up on this in terms of how it's impacted on sort of revenue and budget revenue, in particular in Nigeria. And then, you know, all our budgets are going to increase, and importantly so, in order to safeguard human health and also to support economic activities. So my last slide is just to look at some of the common public finance responses, and this is a summary of what CABRI is in the process of building, and that is a COVID-19 monitor of responses by African countries. So we do see countries tabling supplementary budgets, new finance laws. We see at least 5 countries having done that. Tax relief for businesses. So 18 African countries have put in place such measures. Tax relief for individuals. We've monitored 4 countries that have put in place that facility. Interest rate reductions, so monetary policy interventions, 14 countries. Countries that have set up dedicated funds, some in the form of trust funds. In South Africa, there's a fund called the Solidarity Fund, which I'm sure Mark will touch on. So we see about 10 countries that have put such dedicated funds in place. And then direct support for vulnerable households, and many of this takes the form of cash grants. We've seen 10 African countries that have put that in place already. So thank you very much. And I suppose it is appropriate to end by saying stay indoors, wash your hands, keep your social distance or physical distance, and keep safe, everyone. Thank you very much.
Thanks, Neil. Mark will now hear from you.
Can you hear me, Danielle?
I can hear you perfectly. Thanks, Mark. I'm just going to turn the phone off.
Can you put my presentation up, please?
It should be up. Just have a look.
Okay. Good afternoon, colleagues. Very pleased to share experiences with you all. I'm Mark Blecher from National Treasury in South Africa, where I focus particularly on health and social development. There are some other colleagues from the Treasury also, I think, on this this conference, including Edgar Sishi, the acting head of our budget office, amongst others. Okay, next slide, please. Danielle, can you please change to the next slide? All right. So, I mean, firstly, I think that this has been, we have had to learn fast, very fast here. We had some ideas up front about what we would needed to do, and it rapidly became apparent that that was not going to work. And so we had to learn very fast, and we are still having to learn a great deal. Something we had to realize very early on is that the usual needed to be very different to emergency responses. COVID is not influenza. So in our country, influenza affects about 60% of people. In our country, if 1% of people got infected by COVID, it would take up 5,000 ICU beds. If 10% of the population got infected, it would require 50,000 ICU beds. But we only have 2,000 ICU beds. So that's just one of many, many examples of how, if we don't respond with urgency and very early on and have a very strong public health response, the whole health sector and the whole economy will be very, very severely affected. So the later one acts, the longer it's going to take to control. And the first thing that we started experiencing and started playing around on the curves was what exponential growth means. And it was clearly very easy to reach millions of cases and hundreds of thousands of deaths very early unless one acted. So having to act with urgency kind of was a very early lesson. And there were clearly responses that started emerging from different sectors. So there needed to be a sectoral response from the health sector. It soon became apparent after the president announced the lockdown, after 2 to 3 weeks into the lockdown, that there were a whole lot of groups of people who used to go to work, and they used to get work for the day or for the week and were supporting their families, and now suddenly had no source of income but were locked down. People were being asked to wash their hands, but they didn't have water. The security cluster, in terms of the police and the defense, were being asked to control the lockdown. So there were many implications for them. The housing department was being asked to look at issues like de-densification in extremely dense informal settlements. Many questions around growth, because as soon as the shutdown came, growth slowed massively, and the projections for growth, our Reserve Bank has put out projections showing that growth can decline very substantially. So we might have a reduction in economic growth by 4, 5, or 6% this year, all of which seriously are worsening the fiscal position. And emphasizing the need for budgetary prioritization. Could we have the next slide, please, Danielle? Thank you. So to come on to the health response, the very first thing we had to do for the Department of Health was they wanted to bring back 200 people who were being evacuated from Wuhan, where they had been locked down in Wuhan in China for 2 to 3 months. And the first tool we had to use for that was a virement in the Department of Health. Then the cases started arriving, and it became very obvious that we needed to protect our health workers who were at the front line, and there are a lot of health workers. So personal protective equipment, whether through N95 masks or gowns or goggles or all the other protective equipment, really became absolutely essential. And we then had to use the mechanism of the disaster funds, in this case 468 million South African rand, to make some funding available to provinces in our decentralized provincial system so they could urgently begin to get PPE. Then we had to urgently think how to support the health sector around the prevention and control response linked to the lockdown. So how to test, how to scale up testing on a very large scale, how to support track and trace teams, community teams, community health worker teams measuring temperatures, how to isolate positive cases, what would be the systems to organize those. And then on the hospital side, as soon as the cases started getting large, like in Italy or in the UK or others, how would we make provision for sufficient ventilators and ICUs? And we had to look at tools like substantial provincial reprioritization, working with our provinces or states, possibly using our emergency provisions in our Public Finance Management Act, which is Section 16, or in our provincial, pertaining to our provinces, which is Section 25 of our PFMA, how to amend our conditional grant frameworks for our different grants. For example, our hospital revitalization grant, for provinces, say, to use 5 or 10 or 15% of the grant to make urgent changes to their ICUs or to fix certain things or buy ventilators. Our laboratory services, how to make sure they had the capacity to test. We were fortunate that our National Health Laboratory Service entered the epidemic with a surplus of 3 billion, which helped a lot. And then I got asked to say something about how does this affect our national health insurance plan. So one aspect is that it seems fairly clear that if the epidemic continues to grow, that it will overrun our public sector ICUs. And so then we will have to make use of private hospital ICUs. So we need to think through the contracting arrangements and the fee schedules and so on for our private hospitals. We've had to enter into, because of the difficulties in procuring ventilators and masks and such things, and huge competition at a global level, we've had to create a joint public-private procurement plan for scarce supplies. Some of those are listed there. And we've put in place also the Solidarity Fund, which has been a public-private initiative for funding and purchasing in the epidemic. Danielle, the next slide, please. So on PFM, this is involving many PFM issues, and we again having to think through all the tools in the PFM toolbox. We first just thought, oh, okay, this would be what we call unforeseen and unavoidable expenditure, which we do once a year in the adjustment budget. Well, it only took a day or two before we realized that wasn't going to work. That would have been 6 or 7 months away. We had to move faster. So we had to use environments. We had to use disaster funds. We're thinking of using potentially Section 16 PFMA emergency measures, which the Minister of Finance can put in place. And then the president, our president has taken the COVID outbreak extremely seriously, has asked the cabinet and the finance minister to recraft the budget and to think of ourselves as being at war and to create a war budget. And this might involve changing our current budget that we've sent to Parliament or an early adjustment budget. But it's certainly because of our difficult fiscal position after our downgrade from 2 rating agencies and the fact that we've entered into a recession. Ed Sishi, who I mentioned, is on this teleconference. Someone was emphasizing to us this morning that we're going to have to reprioritize very substantially. So many areas, for example, in the shutdown over the past 3 weeks, which haven't been spending, or other programs that for this year, this very exceptional year, we might have to close certain programs to reprioritize. And all of this is taking place at all levels of government and in multiple sectors. Daniel, the next slide, please. So this is just some range of different options that we're thinking about, because there's a whole group of people who fall between salaried employment and our national systems of social grants or social relief. They include several million informal sector workers like painters or waiters or all kinds of people. So we've been thinking about what options are there to address this group. Do we use our current social relief of distress provisions, cash grants or food parcels? Do we use the child support grant as a large existing mechanism that we currently use, so it's very easy to get into low-income households? Do we use tax credits through our National Revenue Agency, or some totally new mechanism via banks like Thailand did, for example? Each has got pros and cons, and the two tables just show some examples of how we might use a mix of social relief of distress and the child support grant. I won't go through the details of those scenarios. Next slide, please, Danielle. Danielle, can you please change slides?
Mark, sorry, there seems to be a delay on your slide for the paging slides. Can you see it now?
No, I can't see the next slide. All right, so our tax policy section of the Ministry of Finance has been intervened very early. They realized that a lot of firms would have difficulty in this environment where they shut down in lockdown for several weeks or more and could close down, and a lot of citizens who might have difficulty paying taxes, and that to avoid businesses closing down and households going into poverty, put in place measures costing around 15 billion rand. They include the introduction of a tax subsidy to employers of up to 500 rand per month for the next 4 months, for employees under a national existing employment tax incentive that we use, which is envisaged to help around 4 million workers. Tax compliant businesses will be allowed to delay 20% of their employees' tax liabilities over the next 4 months, and a portion of their provisional corporate income tax payments without penalties or interest over the next 6 months. And certain other, I'm not going to go through all the changes, but so kind of a whole suite of income tax changes, once-off income tax changes to try to support firms through what's really a national and global crisis. The next slide, please, Danielle. Again, I'm not seeing the change yet. All right, on fiscal policy. So our Reserve Bank has already put out projections around significant GDP growth decline. These feed into substantial revenue reductions. We entered into the pandemic already with a 350 billion fiscal deficit. These will now be considerably larger. Some have been saying they'll be as large as last previously seen in wartime, which is a very long time ago for our country. Our president talked about a wartime budget, and our budget office is then talking about very significant and substantial reprioritization throughout our budget and looking for many areas of savings. Our asset and liability section is looking at higher bond sales, and also for the first time for a long time drawing on some funding from international partners and development banks. But of course, we also need to start thinking about the post-lockdown period and economic recovery plans post-lockdown. Daniel, please change to the next slide. Sorry, this seems to be lagging, so it doesn't come through to me yet.
Mark, the audience can see your slides. You can see your slides. You can know what you're saying. Identify.
All right. So look, just because I think I may be going over time, This was a slide talking about trying to identify citizens that fall through the gaps between various other categories of income protection, because there are many people, many citizens who face extreme vulnerability during this period. Okay, let's just continue to the next slide. All right, so this slide shows a range of measures that government and private sectors are putting into place to try to support small and medium-sized enterprises through the epidemic. So there's quite a number of different interventions here from government side, a lot of them through our Department of Trade and Industry, our small business department. On this side of this, on the right side of the slide, some of the private sector interventions of grants or interest-free loans to try to get companies to survive through this period of shutdown and slowdown. One of the most important interventions is this one here called COVID-19 TERS. So this intervention is through our unemployment insurance fund, which we, in a fortunate position, is sitting with large surpluses of around 160 billion rand. So they're putting forward around 30 billion rand of unspent surpluses to pay employees that are temporarily not receiving salaries via employers, with a minimum monthly payment of 3,500 rand. This will be paid not just through the normal mechanisms, but also directly through employers or bargaining councils. I'm not going to go through the details of all of these interventions, but you can see that many different government departments are trying to put in place interventions to address the pandemic. The next slide, please, Danielle. Okay, so onto procurement, particularly pertaining to health. So it was clear that we needed to urgently procure a whole lot of things for the health sector. And the first phase of this was that our Office of our Chief Procurement Officer put out circulars about what transversal tenders, which are tenders that are put out, which all the different states or provinces can draw off at fairly affordable prices, what they could draw from, laying out the rules of emergency procurement, because emergency procurement is much easier than normal tendering. One doesn't need to go through the normal competitive practices because it's a crisis. And identifying a whole range of suppliers who might be able to provide these scarce products. But what we found is that although many health departments and police or defense departments or others were putting in orders, that often these items were in very short supplies, and there was difficulty getting them with the lockdown. Often even because airports were shut down, flights were shut down, necessary approvals couldn't happen. And so even these normal procurement processes weren't working very well. And with this, particularly with this huge competition across the world for these scarce items. So in the most recent phase now, we've had to put in place a national public-private partnership, which includes a new fund called the Solidarity Fund, which involves centralized ordering domestically and internationally, international consignments, and also interventions through our Trade and Industry Department to encourage domestic production, like factories going into producing masks and other types of products. Next slide, please. Daniel, just I think it may be the last slide, if you could just change. Right, so this is the last slide. So just in summary, rapid response, emergency response is essential, and the health response has to be at the forefront to prevent a massive outbreak. Even a 1%, I mean, Italy, with all the problems that Italy has gone through, only about 2% of the entire Italian population is infected. So the health response is really important, and prolonged lockdown can be very harmful to the economy. So one really wants to try to get the health response working early and well. Income protection, we found, is very relevant in the lockdown. We've had to already, in a short time, learn to use multiple financial instruments to redirect funds rapidly. all of this has created serious challenges to growth in the fiscal position. But I think our country is saying, look, this is a black swan. It's a once-in-a-lifetime event. We have to, as a country, rally together and get through this period of 2-3 months. The epidemic modelers are, suggesting the epidemic peaking at, over the next couple of weeks or month or two, depending on the various models. So this is a particular national and global crisis that we need to respond very strongly to try and get through, get our country through healthily to the other side. Thank you.
Thanks so much, Mark. That was great, really interesting. We're just now going to hear from the Director General of the Budget Office of the Federal Ministry of Finance in Nigeria. Just waiting for Ben to accept my invitation to come on the screen. Before becoming the Director General of the Budget Office, Ben was the Commissioner of Budget in Lagos State, so clearly a very experienced practitioner, and he'll share insights on how Nigeria has dealt with their crisis, which is facing both the reduction in oil price and the current COVID-19 crisis. Ben, are you there?
Yes, I am here.
Hi, Ben. Thanks.
Hi. Okay. All right. Well, thank you, everyone, for being able to join. I know we all have different things bothering us at this time, and I'm hoping that what we share here today may one way or the other contribute, in just, even if it is to reassure us that we are on the right path. Okay, so I'm going to be sharing with us on managing budgetary pressures, basically looking at Nigeria's twin threats. That's an outline of what we'll be speaking on. Roll on, Daniel, next. Okay, go on. Okay. In the case of Nigeria, I mean, the facts are that, COVID-19 basically made a not so good situation even worse, because even before COVID-19, we were facing a fragile and vulnerable situation economically. Growth was sluggish, growing at in the last couple of years, growing at a rate lower than the annual population growth. Low revenue to GDP ratio, constrained fiscal space, low foreign and domestic investments, declining foreign reserves. We had come down from a peak of about $48 billion 2018 down to about $35 billion now. But then COVID-19 has precipitated a global economic downturn. The IMF says the world, officially the world is in recession. In our own case, oil is a major part of our economy, and oil prices have slumped by the beginning of this year. I mean, 3 months ago, we were looking at oil prices averaging over $60 for the year, but it came down to even sub 22. I'm sure we're all familiar with how this happened. It was basically, we saw a weakening of oil demand in China, which where this COVID-19 originated from, and which was to make a significant contribution to the oil demand growth projections for 2020. And then, of course, this was worsened by Saudi Arabia and Russia under the OPEC Plus platform not being able to agree on a joint approach to dealing with this. If anyone is not clear about the details of this and would like me to shed more light on how this we can take that during the question and answer. But just to understand, oil contributes only about 10% of Nigeria's GDP. But in respect to government revenues, it's about half of government revenues, and even a bigger slice of export earnings, over 90%. And because of the structure of even the other sectors that are heavily import dependent, we then have usually what we call a contagion effect whenever anything goes wrong with the oil and gas sector. Next slide. Okay. And so very quickly, this, what started as an international crisis was quickly transmitted to our domestic environment, because oil, on which our economy, critically hangs, is essentially an international, significant and commodity. And so for us here, what we have experienced, the key impact of this crisis, the disruption to the global supply and output chains, which have basically weakened demand for the commodities, and concomitantly also drag down prices. International travel and trade have been severely disrupted. Demand for goods and services are deteriorating pursuant to the social distancing policies and lockdown of major economic centers. For Nigeria, the epicenter of COVID-19 infection is Lagos, and Lagos happens to account for over 60% of commercial activities in the country, and very significant. Lagos accounts for about a quarter of the GDP of the country. So, and then, followed by the Federal Capital Territory. So, we really have, and then Ogun State, which is contingent to Lagos. Ogun State is home to the largest concentration as far as the manufacturing sector is concerned. So this really, struck at the heart of our, economy. And so we've seen significant erosions across financial markets. The stock market is, in heat everywhere. We've seen increasing pressure on the naira. The central bank has, responded by basically a near 17% devaluation, the official, exchange, rate on the importers and exporters foreign exchange window, on which the bulk of foreign exchange transactions occurs. We've seen a near 7% devaluation, there. The CBN itself has resorted to quantitative easing. It's lowered interest rates. It's launched a number of interventionist lending schemes. Government itself, on the fiscal side, has announced a stimulus plan, and expenditures for healthcare and social safety net programs are being expanded, even in the face of these heightened fiscal constraints. Next slide. Okay. There's, of course, international response to this crisis has been prompt and significant, and I've mentioned here a few of them that have had direct impact on us. IMF has launched this the rapid finance instrument. We are entitled to draw up to 100%. For us, that means about $3.35 billion that we can access under this program, and which we have applied to access. The African Development Bank has also launched its own program. We are also in discussions with AFDB for a $1 billion funding. The World Bank is also engaging with the World Bank for a budget support facility. Next slide. Next slide. Okay. I'll pass on this, but these are just examples of what other major economies, countries are doing in response. Next slide. Okay. So for us, this just shows what this has meant. For us, this slide shows the trajectory of GDP growth, over the last 3 years. For 2020, we had projected a 2.93% GDP growth. The revised projections for GDP growth for 2020 is a negative 3.41%. In essence, COVID-19 is wiping out over 6% of growth for us. So unless we get really lucky, we're likely to, the economy is projected to dip into recession this year. Next slide. Okay. Domestically, response has also been strong and prompt by government. On the 9th of March, the president set up a crisis management committee comprising senior government officials under the leadership of the Minister of Finance, Budget and National Planning, and basically they are mandate to consider measures that, fiscal measures to address the situation. The CMC basically concluded that Nigeria is highly vulnerable to the current global economic disruption caused by COVID-19, but Nigeria is exposed to the risk of both a pronounced decline in oil prices and spikes in risk aversion in the global capital markets. Essentially, we've seen a flight to safety, in the global, capital market. Oil revenues for us have declined by nearly 90%, and that's largely because the 2020 budget initially was predicated on volumes of 2.18 million barrels per day. We've revised that down now to 1.7 million barrels per day. So that's like 20% cut in volumes. Oil prices originally projected at $57 per barrel. We've revised that down to $30 per barrel. So all in all, we've seen the projected oil and gas revenues down by about $15 billion, for the year. And because of the contagion effect of oil on other sectors, overall, we've seen about $20 billion wiped off in, aggregate government, revenues. And although we had a similar experience in 2015, 2016, Nigeria now has considerably lower fiscal buffers than we had then. And all of this is still premised on not a prolonged and severe COVID-19 pandemic. If that were to happen in Nigeria, if the worst were to worst case scenario in terms of the pandemic, then this, the impact could even be worse than this. And so it's absolutely critical that we design and implement an integrated policy framework. Okay, and this includes an amendment to the 2020 budget to address these issues, and that's basically what we are currently engaging with the National Assembly on. Okay, just to situate some of the measures, next slide, Nick. Some of the measures that have already been taken, I classify them in different categories. If I take revenue measures, okay, essentially we have reduced NNPC is the Nigerian National Petroleum Company that manages Nigeria's oil and gas, investments and revenues, and usually they are allowed some deductions for critical, national projects and programs, but we've had to ask them to either scrap some of these or to defer them, and so we've cut their budget for these programs by 53%, essentially by a total of $649 billion, just a little under $2 billion, 649 billion naira, a little under 2 billion naira. We have transitioned to a price modulation process or pricing, PMS. Basically, what this means for us in simple terms is that we have eliminated the subsidy that existed. That subsidy was to cost the Federation $1.5 billion for 2020. So that's been eliminated. With accelerating licensing and renewal of licensing for oil field operators. While this whole crazy situation exists, the sector is ramping up oil production on shut-in wells, since everybody is producing as much as they can in the absence of any ceilings. The last OPEC agreement lapsed at the end of March, but the problem is, people are producing now, but not, selling has become a challenge, and producers have resorted to price discounting, and that includes Nigeria. So discounting to be able to sell. Because of the contagion effect, as I said earlier, of oil, we have also had to revise downwards some other key revenue lines. Customs revenue has been slashed by about $1.7 billion. Stamp duty has been sliced by about 700 million dollars. Privatization proceeds have been cut in two, and that means by about 400 million dollars. Next slide. In terms of expenditure measures, we have cut MDA's capital expenditures by 20%, for overheads, except for the health and security sectors by 16.7%. Capital expenditure and overheads for the top 10 GOEs, that's state-owned enterprises that are integrated in the federal government's budget, been cut by 25%. And of course, those cuts are to apply across all the the GOEs. With expenditure measures, we've been very restrained on this. First of all, we've avoided any cuts on personnel, so there's no plan to downsize or to cut salaries. We've also tried to protect capital expenditure, especially growth-inducing and supporting expenditure, because we think that at a time when the economy faces the risk of recession, we should, despite the fiscal constraints, be counter-cyclical in our fiscal stance. But then the result, of course, is that budget deficits are growing significantly. The overall budget deficit for the federal government will be up by over $8 billion equivalent, for 2020 as a consequence of these developments. There are other fiscal and administrative, measures, as I've highlighted on the slide there. There is a government, a fiscal stimulus package, both from the fiscal authorities and the monetary, authorities. Okay. The next slide. Government has, launched a COVID-19 crisis intervention fund for, 500 billion naira. The central bank itself has launched intervention aid funds for key, relevant sectors for more than double
DG, something seems to have gone wrong with your mic. I don't know if you can hear me now. I'm going to mute you and then see if I can unmute you.
Naira Fund healthcare facilities. Hello.
Sorry, DG, your mic was giving a problem. It's back on though. Thanks. Continue. Sorry.
Okay. What was the last thing you heard me say? I know. Anyway, I think people are seeing the slide, so I'll just go on. So, okay. So the fund is also going to be applied to finance federal government's interventions to support subnationals, the subnational governments. And then, we're also launching a labor-intensive, special works program just to engage about 774,000 youth for about 4 months in some public, works program and get them employed and as all part of creating some, consumer spending power, in the economy. And then, of course, any additional pro-poor interventions as may be approved by the president. As I conclude, said earlier, the 2020 Appropriation Act, based on certain assumptions which we have now been compelled to revise. We're currently finalizing the revised 2020-22 MTEF and FSP as well as the amended budget. And this will provide for the COVID-19 Crisis Intervention Fund and other adjustments required. We have commenced active engagement with the legislature discussing these plans, and so we expect prompt approvals and of our requests when they're formally submitted. Thank you for your kind attention. Hello.
Thanks so much, DG. That was great. I'm going to put all of our videos on now and see if we can start answering some questions with the videos. Hopefully we don't have too many technical issues now. Let's put everyone's. I think DG, your camera doesn't seem to be working anyway, so I'm just going to put Mark's on for now, and I've invited Neil back for us. Just give us answer. We have a lot of really interesting questions over here already, and a lot of. Well, it seems like we're going to have. When I unmute people, it seems like we have this echo. Okay. So, Mark, if you don't mind, if I ask you the first questions while we're waiting for Neil to come back on. We have a question on the role of the Ministry of Finance in a time of health crisis, and I guess we've all sort of touched on that. But I think the question mainly here is, how do you collaborate with the Ministry of Health? So Neil mentioned in the comments that during the Ebola epidemic, the Ministry of Finance actually moved into the Ministry of Health to ensure quicker coordination and that they were really working together in real time. So how do you see the collaboration between the Ministry of Health and Ministry of Finance in South Africa, and what could be done to make that better? Thanks.
So we are working very closely with our colleagues in the Ministry of Health. We're talking to them several times a day. I think all of us, I mean, this has been quite also development of all these electronic communication techniques. So whether through Microsoft Teams or through Zoom or one or other mechanism, it's like becoming much easier to communicate than previously. We involved, I think, with at least 6 or 7 different work groups with the health ministry. So some of those groups are, firstly, we have an epidemic modeling group with about four sets of epidemic modelers with different kind of curves and numbers and models. And so they're trying to align it into one national model. Secondly, we have, and partly linked to that, we have a costing group. So which is trying to cost all the different interventions for the health sector and what might the cost of testing be, and check and trace teams and isolation arrangements. Then we also have a kind of budgeting team which is linking to our Ministry of Finance broader budgeting work, which is looking at trying to see how we make funds available rapidly during the epidemic. And we have also some very specific ones, like there's these big problems around procurement. So our officer, the Chief Procurement Officer, is very involved with the Department of Health around setting up these very unusual and emergency procurement arrangements to try and deal with this international shortages in a whole lot of areas. And then we have a specific one around kind of planning ICUs and ventilators and so on. So there are quite a lot of different joint task teams between the Ministry of Finance and Health, because the Ministry of Finance realizes that, getting the public health response is really that what Agnes Suka at WHO calls the common goods. Getting those common goods right up front, because if you don't get that public health response right, the whole epidemic is going to go completely wrong. So we are working very closely. I don't know, did that answer the question? I can't hear you, on mute.
My apologies. I'm going to mute you now. But no, I think that was really comprehensive and really interesting, and it sounds like South Africa is on the right track in that regard. Ben, I don't know if you want to come in and touch on any of that, or if I can ask you another question that was posed from a Nigerian civil society organization.
Yeah, go on with the question.
Okay.
I think Mark has covered the other one. Yeah.
Okay, great. So this question came clearly from a civil society organization, and they was asking how the government can start communicating, and what civil society can start doing already, how you can ensure transparency, how civil society can start being more effective.
Well, I think that the answer to that probably belongs to the civil society itself. Government has been communicating, extensively about its plans. Earlier this week, the Minister of Finance on Monday held a press briefing where she laid out clearly, the fiscal measures that government was, proposing. The day after that, she was on national TV, interviewed. We have been, after our meetings with the National Assembly, 2 days ago, there were press briefings, there were interviews, including even myself. And so really, it's for, right now, we are extremely busy. I'm trying to deal with this crisis. And so it's really for the CSOs to come up with suggestions about what they can do to support, this effort.
There was another question about how civil society organizations can actually get access to the data of who's benefiting from the increases in the quotas to the general welfare and fighting against corruption. So that was the question. I guess they want more access to data and finding out where they can get that data. But I think you have answered.
Well, they have to approach the agencies. While at the Ministry of Finance, we are, basically involved in structuring these interventions and funding them. The actual execution is taking place at different MDAs, and they'll have to approach those MDAs for information that is not in the public domain. They have, under the Freedom of Information Act, they have the right to seek access to any information that they currently don't have.
That's great. Thanks so much. Okay, I think, Ben, if we can stick with you, you mentioned in your presentation you were looking at foreign aid. So there's a question, and I think we can also bring Neil in here because he has already started answering. But what role does foreign aid play in this pandemic? So how can we be, as African countries, telling our multilateral and bilateral partners what we need from them? So what role can foreign aid play?
Well, I mean, to be honest, we're not focusing keenly on aid because, I mean, even the donor countries are facing their own, fiscal challenges. I mean, we are under the platform of the African finance ministers asking for debt relief, which is basically suspending, debt service commitments. I mean, for the year, not, and whatever other relief they can, that lenders can offer. And this is on the back of the IMF and World Bank itself at the last G20 meeting, asking bilateral, lenders to consider those, such reliefs. But so we're not focusing keenly on aid. We're focusing on accessing facilities that we can, and other resources domestically and externally. We've tapped into domestic contingency funds that the president can access. We're looking at undrawn facilities from the World Bank and other lenders and seeing how we can repurpose some of those to address COVID-19 challenges, and those discussions are ongoing. We had a $90 million regional disease surveillance systems facility for the Nigerian Center for disease control, as well as the Ministry of Environment for other matters. Ministry of Agriculture, for $30 million of that 90. We're saying no, for now, we like all of the 90 to focus on health and addressing the health. Those are the kinds of initiatives we're focused on now, not aid. But of course, we welcome any aid.
Yeah, of course. Right, thanks so much for that, DG. I think I'm gonna turn to Mark now. I'm struggling to get Neil back on, but we will eventually. And Mark, so this is a question from Evelyn from the African Development Bank, and she's focusing on domestic resource mobilization and asking, many countries are offering stimulus packages and relief to businesses, especially SMEs. But what challenges will this pose to domestic resource mobilization efforts? And there's others who are asking, what avenues are there that we can start looking into in order to generate revenue and mobilize resources during this difficult time? Because obviously, we can't rely entirely on foreign aid. We need to be generating some money to pay for this crisis. I'm going to unmute you and unmute myself.
Look, I think generally our tax policy section has kind of put forward the position that they see that revenue is going to decline substantially during this period, and they accept that, and they've actually made it, and I tried to lay out some examples of this in my presentation. They've in many ways tried to make it easier for small businesses and even other businesses to survive by postponing or at no interest, for example, tax payments. So our tax policy section has taken a stance that we are more interested in the long-term survival of these enterprises than getting our the full amount of the tax from them immediately. So I think our Treasury is seeing that the financing of the pandemic will be largely through reprioritization and, where necessary, through increasing our fiscal deficit in the short term. There'll have to be a period after the epidemic where we claw a lot of this back. But this is not the time right now to be putting in lots of new DRM efforts. Right now, each of our countries need to look at really the maximum amount that we can stretch our fiscal position and the maximum amount of resources that we can raise from other sources.
Thanks so much, Mark. That was great.
Thanks so much, Mark.
So, Ben, there were some people who were asking, there were some questions on your last slide. I think it was about, I'm trying to find the question, it was about expenditure measures. And apparently people missed the last part of your presentation. So I was wondering if you could come in. I wasn't sure exactly what the question on expenditure measures that people are interested in, but I think they just, if you know what they're referring to on your last slide.
Well, I'm not sure, but I'll get to that. But I just wanted to echo what Mark, said. Basically, our approach is the same. This is not a time to be driving DRM, new DRM measures. Indeed, that will be considered almost provocative by industry. They're looking instead for us to weigh in. And while we do not have the fiscal space to be able to support them, it's not a time to be it's a time to be as accommodating as we can. The one thing, however, that we've stuck, our Finance Act 2020, which came into effect 1st of February 2020, raised the VAT, the value-added tax rate, from 5% to 7.5%. We have rejected, pressures to waive or suspend that increase, because we think we maintain that a 7.5% VAT rate was still essentially the lowest on the continent anyway. So other than that, the new DRM measures that we are pushing, this is going to be dealt with by reprioritization of expenditures, of course, tapping into any revenue resources that we haven't mined previously without hurting industry, but also then coming to terms with a significant increase in the deficit. From expenditure measures, I spoke about the cuts we've made to capital and some recurrent spending, but I made the point, and perhaps that's what people missed. I said that first, we have, we've been very restrained in adopting these expenditure cut measures. We do not think that this is the time to launch any austerity measures, because the economy faces the risk of, going into recession. And usually, when you're faced with the risk of a recession, one of the things you do is to try to spend your way, out of it. So it's not a time to cut expenditure. It's actually a time to ramp up spending. Unfortunately, there are fiscal constraints. So what we've done is try to eliminate any wasteful expenditures or any expenditures that can be deferred without hurting, growth or anything like that. So this is not the key message I was sending. It's not a time, we don't think it's a time to launch austerity measures. It's a time to actually be counter-cyclical in your fiscal stance.
Thank you so much, DG. DG, can I ask, is there any last words from you that you'd like to mention? I think I'm going to try remove you so that I can bring Neil back in. But I just wanted to find out if there's anything further that you'd like to say before I bring Neil in and remove you.
Well, I mean, it's just to say to my colleagues across the continent, these are difficult times. It's a time to remain focused on the issues. It's a time to in actions that need to be taken. As I always say, every crisis, there's always an opportunity, if not opportunities, embedded in any crisis. And we should all aim not to waste this crisis. For us in Nigeria, one of the things we've been grappling with for years is, how to get rid of the very expensive and low value adding subsidy on PMS. This crisis has afforded us the opportunity to do so because basically, without any subsidies, petroleum product prices could drop based on market forces, and so we have seen essentially about $8 on the so about 80 cents on the liter drop in gasoline prices in consequence. So we've deregulated, and that's one major thing that hopefully we'll never get back to again. And so it's to encourage my colleagues to find the opportunities in this crisis, and take those opportunities so you're not just left with the downside.
Thanks so much, DG. There was a lot of really useful food for thought there. I'll try to bring you back at the end, but I'm going to remove you now and try add Neil. Mark, is there anything from you that you want to come in with?
No, just to wish all colleagues in their national responses well in trying to form their national responses, and again, just to just based on our experience, try to respond early to support the public health intervention to keep your epidemic from growing, because once it gets out of control, it can be very difficult to pull back. So rather try to put those public health interventions in place early and strongly.
Hi, Neil. Thanks so much. Hi.
Okay,
sorry, we were struggling a bit there to get you back on. There was a question on regional markets and what regional entities can do in times of crisis. So what should the role of a regional organization be during this time? I was wondering if you can provide us with any insight in this. Example, for the AU, you've done quite a bit of work with them. Yeah, just you can provide us insight.
Thanks, Danielle. So at a heads of state and government level, there has been virtual meetings, and as you know, South Africa is currently the president of the African Union, and just from the communiques of their first meeting, it is efforts to bring about a more regional response, to look at issues around strategic procurement, because there's going to come a time where, as depending on where in the curve countries are, that the purchases are going to have to be made, from facial masks to other personal protective equipment, ventilators. I think Mark and DG mentioned in their presentation how understocked, Africa's number one and number two economies are, and that's certainly going to be the case for many other African countries. So I think just exploring regional approaches, and seeing how with the closing of borders, how you can still ensure that strategic purchasing can take place in order to improve on negotiations, improve on what we're going to be paying for equipment that's obviously in high demand at the moment. So I think it certainly is a role for regional bodies like the African Union. I just wanted to touch on a couple of other points. I see we are nearing the end of the webinar. I mean, the earlier question around civil society organizations, I think the point has been made and across the globe of the importance of transparency. This is especially transparency in terms of the data that is provided, not just the rate of infections, amount of infections, and the number of recoveries, but also data on what funding is being made available, how budgets are being adjusted, and on the role of the various government institutions. There's certainly, once we start looking at mass quarantining, as soon as we start looking at what do we do about homeless people, vulnerable people in society, that we're going to have to draw civil society organizations and volunteers into those kinds of efforts. And I think this is a point also made by the WHO Director General, is that transparency is going to be important. We've closed our borders, but this does not mean that we shouldn't be collaborating in a transparent way in the efforts that we undertake with multilateral organizations and also internally in each of our countries. On another question related to foreign aid, I think it's really two parts to that question. I mean, the one is the immediate financing available to support the national efforts to fight the disease, and the second part is, does this impact on ODA going forward? And I think the more important one is the financing one, the immediate financing one. I mean, the World Bank has put in a very significant amount. It's $160 billion that's been made available to support COVID-19 efforts. African Development Bank has also raised through a bond $3 billion already. Support from the World Bank facility has been given to Kenya, and I think it was two days ago that it was announced that the IMF had provided balance of payment support to Rwanda. So I think this is rightfully what should be occupying our minds at the moment, and our effort is what kind of funding is available right now to support the effort, and very significant amounts that the World Bank has announced, and the African Development Bank, and the IMF MD has also announced that the IMF's $1 trillion is standing available for the support. I mean, so it's not going to be the entire amount, or far from the entire amount, but that's certainly where the lead in external financing is going to come from. Thank you, Daniel. Daniel, you're on mute.
Sorry about that. Sorry. I was saying that we've come to the end of our webinar. Thank you so much for joining us. I'm apologizing for some technical glitches. We are going to have another webinar in 2 weeks on a topic that's going to come out from the questions that you've been asking. So things that you found relevant, we'll focus on. So if there's anything else you want to let us know, you can send an email to me. I'm going to type my email into the chat box now. If there's any questions that you want to ask for the panelists that we didn't get to today, I see that we didn't get to quite a lot of them. I've typed mine into the chat box. You're welcome to email me about anything, any feedback you want to give us. Also, just to thank our development partners for their support of this. That would be the Gates Foundation, the Bill and Melinda Gates Foundation, Hewlett-Packard Foundation, GIZ, African Development Bank. We're very grateful for their support in making this webinar possible. And also, please look out on the CABRI Hub, which is cabri-sbo.org, for a new monitor that we'll be launching, hopefully next week, which will track the responses, the public finance-related responses of all countries on the continent. So looking at some of the measures that Neil listed in his presentation per country, and that'll be updated continuously, obviously, as this dynamic situation unfolds. And also, please join our social media pages. We have a Facebook page, we have LinkedIn, we have a Twitter account. Priya can add details in the chat box on that. That's our communications manager. And we will be sharing all the slides, and we will be uploading them onto our CABRI Hub, cabri-sbo.org. Thank you so much for all your attention, and we really appreciate your joining us. Thanks so much. Bye, everyone. Thanks so much, speakers. Thanks, and Ben, thank you for your wise words about there's opportunity in crisis. I totally agree, and let's take advantage of that. Bye, everyone. Thank you. Bye.